Today, we're going to talk about expectations after your hip replacement. My name is Dr. Anthony Murray, and I am a hip and knee replacement specialist from Town & Country Orthopaedics. I normally allow full activity after your hip operation using an anterior surgical approach, such as being able to lie on the surgical side from day one, sit on a normal toilet seat, cross your legs, and get in and out of cars without concerns. Some restrictions, such as extreme body positions in Pilates or yoga, may need 2 months before being performed, and activities such as surfing, skiing, or running long distances will need to be discussed. Directly after your surgery on the same day, you are stood to walk a short distance, normally with our physiotherapists, and you'll get a feel for getting up with the new hip. Sometimes people are dizzy or feel too weak and may require a little longer to get going, which is fine. Despite modern advancements in anaesthetics, pain relief, and surgical techniques, and utilising a minimally invasive muscle-sparing incision, a hip replacement is still a painful operation. I tell people they won't like me very much from day 2 after their operation, and they won't like me for 2 months. Surgery, like everything in life, is a trade-off. You trade your arthritic pain, which has no endpoint and will wax and wane, for surgical pain, which should end in a period of time. Generally, most people require some crutches or a walking frame for a few days to help you get back to walking normally. Some people will require an aid, such as a stick or crutch, for longer. However, this depends on how good your mobility is before the surgery, amongst other factors. I like people to be the tortoise rather than the hare. Whilst mobility and early movement is key, I don't crack a whip on you until your wound is healed and you feel you're comfortable enough to be more mobile. At 2 weeks, your wound is checked and the physiotherapy can commence with a physiotherapist recommended by me or someone that you already know and trust. On your review at 8 weeks after your surgery, you can expect to be feeling a lot more normal than in the first few weeks following your operation. You will have an X-ray performed before seeing me, and we will have a discussion about your progress. You may report odd feelings and irregular strange aches and pains. I give the analogy of a filling in your tooth. When you first get it, you rub it with your tongue and notice it constantly. Just like that filling, so too is your new hip joint artificial, and you notice the small things following the operation. However, over time, some people start to forget they've had a joint replaced, and at 8 weeks, a lot of people are feeling much more comfortable. A lot of people report feeling that they have forgotten that they have had a hip replacement from around 12 months after the surgery. This is what we refer to as a forgotten joint. As always, I hope you learn a little. Please leave a like and subscribe to this channel to receive more educational videos on hip and knee replacements.